Associate Professor Brian Aller is the president of the AMA, and he joins me now to talk about those health cuts. Professor, good evening, and thanks very much for coming in. Can the public health system still operate at its current standard if $2 billion is cut over the next 5 years?
No, it can't, and we know that there are going to be further cuts that come along from 2017 when the formula for funding our public hospital system changes to CPI and population growth. It's just not possible to provide the range of services in the time frame that patients need and should expect to receive them with these sorts of cuts coming from the Commonwealth.
All right, so it's tricky though, isn't it, because the Treasurer says there's no cuts, there's more money. But how does that actually work out with the demand for healthcare?
Well, we know that the cost of providing healthcare is increasing year on year, but what we're actually seeing is a reduction in that growth. So particularly from 2017, the formula that's going to be used for funding our public hospital system will mean that the public hospitals will only, or the states or territories will only receive around a 3 or 4% increase, when we know that the cost of providing those services is increasing by at least 7% or so per annum.
Okay, right. So if the money doesn't come, if that shortfall isn't reinstated by the states, what are your fears for public hospitals?
Well, that's the problem. We know that states and territories don't have the ability to raise the revenue to cover the shortfall, particularly our smaller states and territories. So I think patients will wait longer to receive their surgery, wait longer in our emergency departments, and I think the range of services that will be able to be offered through our public hospital system will also be compromised. So I think there really are going to be consequences from this for everyday patients, and particularly in those smaller states and territories with smaller economies. I think the inequity that we already see there is going to be exacerbated.
Last year when these cuts were first announced, there was a sort of discussion that maybe the federal government wouldn't wear the pain for this because it would be seen to be a state responsibility. I mean, what scope do you think the states have to cover that gap?
Well, they just don't have that capacity, and we know that Mike Baird has said recently that this is the biggest finance issue facing states and territories, not just in terms of health, but because health is such a big component of state and territory budgets, it really impacts the whole bottom line of each state and territory. And we know that many of the smaller states and territories with smaller struggling economies are really going to struggle because they just don't have the ability to raise the revenue and the gap.
All right, so last year we had the big bun fight between the AMA and the government over the GP co-payment. And this year we're discussing these cuts. How do the two matters measure against each other? I mean, how concerned are you about these cuts versus how concerned you were about the GP co-payment?
Well, I think the GP co-payment really distracted people from these public hospital funding cuts because we spent a year basically discussing the GP co-payment. People could actually understand that much more easily because so many more people go and see their GP, of course, and those changes were going to be much more immediate. But these public hospital funding issues are now becoming much more relevant because the cuts are now starting to happen, and 2017, when the real changes begin, is only just around the corner. So I think people are becoming much more focused. I do hope that the COAG Leaders Retreat in July will be an opportunity for the premiers and leaders to get around the table and come up with a solution that our patients need and expect.
How would you rate the government, though, in general, with its attitude towards health? Because obviously it seems that as the razor game goes along all the different budgets, it looks at health and thinks, wow, there's so much money there that we have to target health. Is that how you see the sort of the overriding strategy from the government towards health?
Well, certainly I think the last budget, that's exactly what we saw, and a lack of consultation, no discussion with the AMA or any other health group for that matter around making those changes. Now, I've got to say that Minister Lee has been much more constructive. We've had many meetings with the Minister to discuss health policy and what changes might be made, and we've got an approach that is there to review the MBS and primary care and come up with some recommendations about modernising the schedule, which is about access to patient services, and making sure that we make some real changes. But this year we've seen health funding, although it's increased as a proportion of the federal budget, it's actually reached one of its lowest points, now being only 15.97% of the total federal budget expenditure.
Very briefly and finally, do we, though, there's the commentary about the government, but what about us? Do we have to change the way in which we think about the public health system, given that we're all getting older and revenue is dropping?
Well, I think we certainly need to concentrate more on prevention and chronic disease management, but there's still a lack of political will to actually put the dollars in to do that. That is one of the strategies that will work, but we still see patients that are sick. They're